We want to talk about what happens in the brain. Particularly in our research, we found that the brain can change due to experiences. How?
When individuals now started taking enhancing substances that, you need to hit, you need to pass, you need to relate, you now need such substances to make you to do the normal thing you're supposed to do. And that is basically what happens in the brain.
I think it makes me have more sympathy for people with substance abuse. Dr. Segun Akindokun is a consultant radiologist and chief medical director at Everright Diagnostics and Laboratory Services Limited, with expertise in medical imaging and brain health.
You see people doing like jacking their body, you think it's spiritual problem. Again, it is that the brain was overfired at that point, and the person's brain cannot understand what is happening, and it goes into that seizure.
Welcome once again to Beyond Addiction Podcast. As always, I am Amadin Ogbewe. It's an exciting one today. We want to talk about what happens in the brain, the neuroscience of addiction. We've been talking about addiction for quite some time now, but I think it's time we understand what's actually happening. And that's one of the more interesting bits of conversations like this, because we get to learn a whole lot and we get to understand that perhaps it's not always an issue, or never actually an issue of moral failing, but actual science. To break down that science to simple, digestible, and understandable words, we have Dr. Segun Akindokun. He joins us now to really break this down. Today, actually, I'm overwhelmed by the doctors in the house because I'm the only person here who is not a doctor. My co-host, Dr. Hope, is also here. Welcome. It's good to have you, sir.
Oh, thank you.
All right. So let's go straight into it. The idea people have always had of addiction is that the way Dr. Hope put it the other day, which is how other people put it, he don't take a drug, or he has gone to take something like a choice, a moral choice, a failing. Can you tell us actually what is the science behind this? What is happening? Particularly in our research, we found that the brain can change due to experiences. How? What is happening with addiction?
Oh, thank you very much. And in the simple way of definition of addiction, it has been defined as the chronic brain disorder that makes individual to continually use a medication or substance irrespective of negative consequences. So, which means the problem is beyond what we can see physically. In the brain, we have the normal survival networking in the brain. How do I mean? We call it a reward network. That is the nerve connectivity in different parts of the brain that make us to do the normal thing, like we want to eat, or we want to play, we want to sing. Those are surviving mechanisms that we all have. Oh, you can run when there's danger. Oh, you need to hide. Those are the surviving mechanisms. Now, in addiction, this surviving mechanism is tampered with, is distorted, is disturbed by chronic continuous use of different substances. We have the legal and illegal substances that people can use. And what it happens, that's what we call a mesolimbic dopamic system, whereby dopamine is a neurotransmitter in the brain that controls this surviving mechanism, or we call rewarding mechanism in the brain. If individual has been persistently, chronically used substance over the times, in the beginning, these dopaminergic neurons will produce more receptors to accommodate such substances. At long run, the receptors will be depleted.
So can you simplify that?
Okay. Now, individual that has been exposed to different substances.
Yeah.
We know examples of substances people use like cocaine, which is a stimulant, marijuana, heroin, methamphetamine, like that.
Yeah.
Now, in the brain, there is a receptor that helps to produce what we call dopamine. Dopamine is a neurotransmitter that enhances normal activity, the surviving mechanism human beings to have. But those people that are exposed themselves to these substances I've mentioned, they will not have more
Dopamine is what makes people feel good, isn't it?
Exactly.
It's as good as saying it's a chemical that the brain produces.
But it makes you feel good.
Because people wonder what neurotransmitter achieve.
Exactly. Okay. Yes. It's the chemical
Yes.
that make us to do the normal thing we need to do
Okay.
to survive. Normal thing we need to do. Now, when individual now started taking enhancing substances, this will increase in production will increase initially. And because of that, the receptors where those chemicals will attach in the brain will also increase. I will now get to a point that it will be going down. It will be depleted. And for individual to now function normally, that, you need to eat, you need to bath, you need to run, you need to relate, you now need such substances to make you to do the normal thing you're supposed to do. And that is basically what happened in the brain. And now, as individual is exposed to that substances I've mentioned, and the dopaminergic neurons getting depleted, not only that, that's part of the brain that we call prefrontal cortex. This region in the part of the brain is the one that determines activity of making good decision, decision-making point. It's also the part we call impulsive control. Self-control is that part of the brain that governs it. For individuals that have been exposed to chronic usage of those substances, now that part of the brain will be shrinking. That part of brain will be getting smaller. That part of brain will not be active as supposed to be. And that is what now make individual to, despite individual has been informed that if you take this is the consequence. You say, no, let me be taking it. Because that part of the brain that's supposed to control that, this is abnormal, don't go for it, is going down in capacity. It's not working as ought to be.
Do you mean physically, like the size of your brain, the cortex is actually reducing?
Yes, we call it atrophy. That is the end result, atrophy. That is getting smaller in size. And also in activity, the neurons, the nerve discharge will reduce. And this is what we use to evaluate individual in neuroimaging, to check how this brain look like, the activity, the function, the structure.
So if you saw the image of someone who has substance abuse issue, could you tell from the image that something is wrong?
Exactly.
In
fact, one of the role of using imaging to evaluate individual with drug addiction is to rule out other things that can mimic what individual is displaying. We use imaging to rule out, this is likely what is going on, this, and what is going on. For instance, if you see a younger individual that is behaving abnormally what may be going on, there can be a tumor in the brain that can cause individual to behave that way. You can see somebody that just lung, it's having rupture of the blood vessels, that's having bleeding. We want to see. This person is not a known hypertensive, it's not having high blood pressure, it's not a known diabetic that are prone to such. Why this one happened? When we have the brain imaging done, MRI or CT, we see evidence of bleeding. This is acute phase. They need to take care of this before we go to the chronic phase. There's nothing like that. What we are seeing is a chronic phase. We know that if we are seeing brain atrophy in the frontal lobe, that is the front part of the brain of individual, younger age group, and they are not having all these conditions I've mentioned, hypertension, diabetic, not a sickle cell patient, definitely you want to suspect.
Lesion,
yes.
So you can suspect.
Want to suspect that, there must be substance abuse somewhere that this person has been exposed to for a longer period.
Okay, sorry to jump the gun, but one immediate question jumps to me when you say the brain is actually affected. Immediately, I'm curious if can it revert back to how it was? Because when we talk about the path to recovery, because we've talked about it a lot here, it has never actually occurred to me that something physical in the brain may need to change or...
Yes. What usually happens in recovery phase, But that is one of the role of imaging, to monitor the therapy, giving it to the patient, maybe any medication, and see changes, especially functional images. Now, the atrophy will not reverse, obviously, but the function, the nerve function, and the hormone produced, like the neurotransmitter mentioned, will come to normal. That can make individual to function normally.
Okay, fair enough. I don't know if Dr. Ogbewe wants to come in.
Yeah, I mean, Chief is saying a lot that I think that Nigeria may have to step up even our current level of intervention for individuals who suffer drug addiction, because I know that neuroimaging is important, for assessment of patients, but I don't also know to what level we are engaging, experts in neuroimaging to assess patients, for care. Earlier in one of our episodes, we've discussed how the cost of treatment for individuals who suffer drug addiction, and someone quoted that one of the neuropsychiatric hospital, Federal Neuropsychiatric Hospital, it costs about 2 million naira for a 3-month stay. So, and I'm wondering if we have to include neuroimaging. I'm sure, sequentially to see, okay, when the person is coming in as a baseline assessment, and then in the course of treatment, reassess again, and all of that. So
yes, it's huge. Yes. Now, the role of imaging in evaluation of patient with addiction, I will explain it in due way. There is what we call an acute phase, that's what we call chronic phase, and that's what we call recovery phase. Now, in acute phase, for instance, somebody is walking in his office and just slump. Or somebody is walking in his office and have irrational talk. Now, the imaging come to play. Now, like amphetamine, cocaine, and others, studies have shown that they can cause spontaneous hemorrhage, bleeding in the brain. Yeah. So how do we know that this patient is actually having bleeding now or before? It's imaging that will show. There may be evidence, the clinician may elicit some signs in evaluation, but imaging will show us what is going on. And if the individual is bleeding actively, the line of management will be different because they need to take care of acute phase first. Now, in chronicity, he has been taking this medication, he has been doing this for a while. We want to see what are the changes that has been there, even while on treatment. And also, while abstinence from the medication, you want to see that, is there any improvement? You need to use imaging. Now, as rightly said, the imaging is very huge. Just like in part of the world where we are, most of images that can be used are not readily available because we have the functional imaging, functional MRI, we have functional radionuclear imaging, that is the PET and SPECT, not readily available. But what is really available in our society is computed tomography, that is CT, and the MRI, magnetic resonance images, that can be used initially. As you said, somebody can have tumor in any part of the brain and be misbehaving. And not doing imaging, even in local place, they will say, it is arrow from enemy. It is attack. But meanwhile, it may be obvious tumor that is sitting somewhere in the brain that just require removal, and the person will be okay. And it may not even be associated with the addiction, and it may be associated with it. So that is why imaging is very important. And some of the patients that are even in the neuropsychiatry imaging, apart from the addiction, they still use imaging to evaluate the one that's available, MRI and CT.
Well, for the viewers, Chief has mentioned tumor and some other occasions where people may behave irrationally. You see, it's not everybody that behaves irrationally that has a psychiatric problem. So because most people just see someone behaving irrationally, let's say it's a spiritual problem or it's a psychiatry, has gone psycho. In fact, sometimes you may have worms, gathered and form a ball in your brain and then occupy that space and you can start behaving irrationally. And then to also I think I saw some neuroimaging of an individual who had taken cocaine. Now, the first day he took the cocaine, a picture of the brain was taken. And then 100 days after cessation of use, a picture of the brain also was taken, which underscores, the neuroimaging interventional measures for people suffering drug addiction. Now, that imaging showed that the brain of the person actually shrinks, just as Chief says. Anatomically, structurally, it reduces in size. And that tells you that it's also reducing in mass. So if your brain was weighing 1 kg, because you are taking drugs and substances, it can start weighing 0.9 kg. Now, not just because of these other issues, it's as I've also shown that some of these drugs leads to dehydration, even of the brain.
Of the brain.
Yeah, so your brain loses more water than it should have. So, of course, and then, like Chief has said too, neurons are going to die. These neurons have small weights, which accumulate together to form the weight of your brain and the anatomical structure and the picture of your brain. And of course, Chief also mentioned again the physiological effect that also happen in the brain. Now, which you can refer to as electrical activity. So for the viewer, and I just think about a house, plenty wires. And that's what your brain is like.
Exactly.
And the neuroimaging expert is saying that when you take substance, initially, the wire will seem to multiply. Because why? The drug itself elicits those areas more than the normal activity.
Yeah.
So because if you like to go to swim, you like to eat, you like to read and make good scores, which elicits or fire your reward system. Now, those are normal stimuli to your brain. Now, with time, if you now take this substance, they fire those brain area more than what the normal stimuli would have done. And so the body will respond to adapt to it and generate more neurons for you. Now, with time, they burn out because the firing coming is too much for them. In fact, so people take substance and because of the excessive firing, they have convulsion. They have seizure. Okay, you see people doing like jacking their body, you think it's a spiritual problem. Again, it is that the brain was overfired at that point, and the person's brain cannot understand what is happening, and it goes into that seizure. That manifestation that we call seizure. Right? So it's not just taking substance. There's a lot that happens behind the person's brain that produces behavior we are seeing. So if neurons later on begin to die, Chief maybe later explain what neuroplasticity means. Now the neurons begin to die later. So you see there's a depletion, the neurons start dying below the initial level of the neurons you have.
Exactly.
Okay. I think to play the layman here, obviously, because I'm in a room of doctors, I think it makes me have more sympathy for people with substance abuse disorder.
Absolutely.
Because, for instance, let me use myself. Let's assume as we speak, I don't have a substance abuse problem. Can make that successful assumption. If I then develop one, it means that even though the size of my head did not reduce, the brain inside the head
has reduced.
Exactly.
has shrunk.
Yes.
So it's like when you are judging someone that, why don't you stop taking? Can't you see what you are doing? Now, which is a question I wanted to ask. Can a person know what is happening? Perhaps to even take it to an extreme, let's say a doctor, because I know that addiction doesn't have any, what's this called now? It doesn't select, so to speak. So let's say someone who even knows the way these things function, and then, like you said, the prefrontal cortex starts reducing, the decision-making process portion is
affected.
Yes. Can they still make logical decisions now that it's out of their hands? The brain has actually shrunk already.
Yeah, thank you. That is where the treatment comes in, which is therapy. It is not only to make use of other injections or medications alone, but coaching and therapy, psychotherapy, that is where it comes in.
And this has an effect on a physical...
Yes. Don't forget, part of the stages of drug addiction is that it will get to a stage whereby individual will continue to take such substances despite individual knows there's negative consequences. It's just because the aspect of the brain involved in decision making is no more working for individual.
How long does this take to happen?
Well, it depends on the exposure, the quantity, the volume of what individual takes. Some that started taking the lower doses and they didn't increase it, then it takes for about 5 years, 10 years before this happens. But most time, they usually increase what they are taking because of the euphoria, because of the pleasure they derive in taking it. So it makes them to even take larger quantity in a shorter period. So that is why you see it happens within a short period, 2 years, 3 years, you will see the manifestation.
Maybe, Chief, again, depending on the biological makeup of the person. So sometimes we x-ray, body size, for instance, someone with a bigger body size and someone with a smaller body size. So those are biologic differences. Now, that also goes in for male and female use of substance and how it affects both genders. Then again, if the person has genetic makeup that could predispose to an addiction, so you see someone who has, you see the same quantity of substance with this, the same time, the same type of substance, the same dose, but then he needs intervention before the other person needs intervention. Okay, so these are some of the factors, as Chief mentioned, in the quantity he's taking, the kind of drug, and some of these drugs are adulterated. Some of them are not coming in pure forms for the individuals. Some dealers mix them. For those who are using substances, there are dealers who mix them with other substances, other chemicals, so that you get a faster high, a bigger high, and you keep patronizing them. It's like a Chicken Republic or other food vendors. They ensure they put in good ingredients that will make people want to keep coming for their meal. So the same thing for drug dealers. They are going to add other substances just at your own peril, so that you can keep coming to them.
And you feel that this quantity is good. Oh, the one I'm getting for so
is a good one.
Let me
is this why in the movies when a transaction is going and they have a taste, this one is good.
This one is better.
This one is...
Give me your plug. Give me your plug. And these are the detriment of their brain.
Now, the other thing you ask that, for instance, let's say the person is a medical practitioner, and how would the person get out of it for the treatment? And also, like I've said, apart from the medications to control other symptoms, the therapy, psychotherapy is very important. And one of the things I will mention is this, there's something we call cues. Those are the things that make individual to be craving for such substances, which can be where the individual is living, or maybe one individual is exposed to party, it can take more of alcohol. If individual see people that are taking marijuana around, it can quickly go back. So such individual will be taken away from anything. Environment.
Yeah, so Chief is talking about triggers.
Triggers will be taken away from that, so that the normal neurons can come a bit for individual to realize what is going on. Because if individual didn't have insight, it will be difficult to move out of that.
Yeah, talking about insight, Chief, most times, mental health patients generally,
they lack that.
Not have insight.
Exactly.
So that is one of the things that psychotherapy can help build insight. Now, it is multidisciplinary. Okay, we have the role of the pharmacotherapy. And then, of course, a licensed clinical psychologist is not licensed to prescribe medications. So that's where your psychiatrists come into play. So in our rehab centers, for example, we have psychiatrists, clinical psychologists, medical doctors, nurses who serve Medicare and all of that, right? And even pharmacists, right? Now, so this underscores the fact that we have a bigger problem sitting with us than, stop this drug issue. Can't you stop it today? Chief have said that this person is taking it in the face of negative consequences. And that mentions already 2 C's of the 5 C's. There is a chronicity pattern of drug abuse. There is negative consequences that the person is aware of. Another C is that there is compulsive use. The person does not have the control to use uncontrollable. That's the fourth C. And the other C, the last C, is that there is intense drug seeking, which we call craving. And the Chief will x-ray this better again. I give this analogy that like an infant who is being weaned from breast milk, and at night you see them crying severely for that breast milk. Now, I have always said that this is how the brain of the person who suffers addiction knacks the person. It's like, I want to give you this thing now, or I die. Now, that is the experience. Chief, what do you say about this intense craving, intense drug-seeking behavior? Because someone who's addicted, even if it's 2 a.m. midnight, that person will scale the fence to go and meet the dealer. Now, someone who's addicted will drop his Rolex watch or his iPhone to get just a gram of a particular substance. You say, when I pay, I'll come and collect my phone back. So what is happening?
Yeah, thank you very much. It's part of the sequelae of effect of these substances on the brain. Now, we have what we call reward systems that majorly involve the striatum in the brain, and then we have the prefrontal cortex. Then there's what we call striatal cortical fibers, nerves that connect these points in the brain together. So it will get to a point that these nerves, this pathway will be depleted, will be affected, and that is when craving comes in. Now, craving is not something that happens initially. it is as a result of chronic usage of that substance that makes that pathway that control decision we just got distorted. And when that pathway distorted, that is when craving will, just like what you said, uncontrollable. They will be seeking until when they get it.
And this is due to a distortion in a pathway in the brain.
Exactly. It's distortion to that pathway that makes them to get to that point. And as I've said, initial stage, they don't have that experience.
Yes.
The more they are exposed to that substance, the more they will get to that
So
point.
initially, someone who started using drug now is able to control his use behavior.
Exactly.
Chief, it has been said actually that the first time of use is voluntary. But when it becomes an addiction, it becomes involuntary for the person who suffers the addiction. So you have someone who is suffering addiction, and you keep thinking that this person is doing this voluntarily. But this person wants to put the family's name to shame. So that's why we are saying it's not moral failing. It's actually a distortion in the person's brain that is causing this uncontrollable craving and drug use behaviors.
All right, so let's go. I think if I want to do a quick summary now, when you have chronic substance abuse issues, your brain changes. Sometimes things that link parts of your brain can be cut off. Again, so the question now is, let's talk a little bit about what recovery looks like. So when you mention psychotherapy, I think the first thing people are saying is somebody is seated on the couch and you're asking, what happened? Did your father treat you badly? What was the source of your trauma? So it is hard to link the treatment that we're talking about now, which has to do with the mind, speaking and all of that, with something that you just mentioned has an actual physical effect. There's a shrinkage, there's a,
depletion of chemical.
Yes. So how is recovery for this supposed to be? Is someone out there listening now, can their brain go back to normal? Or what does recovery entail?
Yeah, thank you very much. And the brain can go back to normal in terms of production of the chemical, dopamine, can go back to normal. But in terms of the size, for those that have been to chronicity of misuse of those substances, that the brain has already shrunk, such brain will not increase in size. No. Then what will happen is that the function, that is what rehabilitation will bring up again.
So when you say something was broken, that link, what happened to it? It's never coming back.
Yes.
I'm talking about the physical thing.
Yes. Okay. Now, when I'm saying the connection between one part of the brain got distorted,
yes,
it is not in the physical way as if you are cutting a cable, a rope. Okay. In terms of function, it's distorted. In terms of size, it reduces in size. And because of that, that is when they will still have that function back. But for the size that has reduced, you cannot regain that size.
So what's the implication of that?
Yes, implication of that the individual has to be perpetually motivated psychotherapy. I give an example of what we call cues, triggers, things that make individual to go back to old habits. Like, you used to take that when it goes to club or when it goes to partying. I have to move away from that.
Well, I was actually speaking of other things we know the brain does. I'm smart. I'm a smart person. Smart individuals, high-functioning individuals get into substance abuse because somebody told them, if you take this drug, you read better, you study harder, you understand better. So I'm wondering what happens to someone perhaps who had high IQ, who was thinking well, or is there another side of the brain that remains untouched? Because I'm imagining, so of course, when people are talking that you are smart, they say, your brain is big. Now your brain has reduced. Are you still smart? What do you lose from that?
Now, thank you. Now, don't forget the part of the brain that's being affected is that part, decision making, and active learning or forward thinking, judgment, habitual control. That aspect is affected. And there are two ways. The electrical aspect, in terms of what you cannot see physically and what you can see in terms of size. Those are the two parts being affected. In terms of what you cannot see physically, that's electrical aspects that can be regained by the available treatment, psychotherapy, and then some individual, they give medications that can be regained. But in terms of the size of the brain, that cannot be regained. And such individual, that is why the psychotherapy thing is a continual process. It's not, oh, you've done it, it's out of it, and that's all. Those cues, those triggers, once they come around, it can stimulate. Don't forget, the memory of individual is still there. Mm-hmm. It can bring it back. And people just go back to the same thing.
Chief, this underscores again conversations around what recovery is about. And we've considered that recovery is not a seasonal or an episode program where after 3 months, after 6 months, after 1 year, you go home and that's the end of it. And there is nothing as, oh, I am fully recovered. There is nothing like that in drug addiction. You are in recovery for life. We have said it before on this show that anyone who is in recovery, who began a recovery journey, is a lifetime journey. Now, because most time patient relations are not patient.
Exactly.
They are always, I'm not saying this to make excuse for the sufferers, but I'm saying this to enlighten family members, supporters of the sufferers, who, although, yes, resources are involved, you are paying money every month, you are spending millions of naira every month, and you just want a magic to happen. But you must know that it's not just a magic that will just turn overnight. It is a process, and it's a lifetime process. Because if you have never used a particular substance, you are not in recovery from that substance. But if you had used a substance that has built, for instance, a drug memory, there's what we call drug memory. Because the person, like Chief said, there is a particular patient that her own trigger was early morning Saturdays. She just come out to her balcony and the sun hits her face. The next thing is she wants to take alcohol. Now, so in treatment, we were able to recognize that. And we said, okay, on Saturdays, find something to do. Because why? Monday to Friday, she goes to work. She won't come to the balcony. On Sunday, she'll go to church. But on Saturday, she will be at home. So fine, she got a pet. And then, of course, on Saturday morning, she took a walk with the dog, with the pet, right? So that changed it for her. So now...
And this is having an effect on her brain as well.
Of course, yes. Now, so it's a rewiring that happens with therapy that Chief is talking about. Because, there are times where you have to give medications to help either reduce dopamine level or increase dopamine level to manage the patient. Because this dopamine level we're talking about can be so much that, or can be less to a point where it produces symptoms, physical symptoms. Person can begin to talk vivaciously, high volume talks, or become grandiose in what he's saying, or start hallucinating. These hallucinations differ. It can be tactile, different level of hallucination. Oh, I'm hearing voices. Sometimes they can have spiritual referencing and say, oh, I have a vision. The devil is this. We see a lot of things in treatment, right? Now, it's dopamine levels. And, of course, brain issues that are happening there, which sometimes, again, if you don't get the person to be in touch with reality, you may not be able to administer psychotherapy. Because you are telling him this, he's telling you and that thing. But you have to bring in medications, to get the person to a level where he can now engage psychotherapy. Then psychotherapy continues. And for life, this person will require that support. He will need to keep using his coping strategies. We need to keep using what he has been taught on managing his cravings. There is what we call the 4 Ds of managing cravings, which is the cues Chief mentioned, right? So these are the things. Some people, it's just a dream. Some will dream about the drug, wake up and they have to go and take the drug for it. It's the dream. Some is their girlfriends. Some is a particular motor park. Once they pass that motor park, for some is a particular friend. Some may be emotional issues, which is where Chief may highlight area on adverse, issues, right? Childhood experience and trauma. Some is that they're not able to manage, rejections, disappointment. They don't, or some have poor time management. You are a student, you should start reading on time. You are not reading on time. A friend will now tell you if you take the substance, you will stay
happy to cover.
So it's time management. Some is financial management issues that are the problem. Some is problem-solving issues. They are overwhelmed easily with circumstance and stress. Some is stress, either from their workplace or what have you. So you see, all of these issues, when you look at them, they come back to compound the problem that the brain is facing, not handling the drug.
Oh, all right. So okay.
The brain never fully recovers, really. So patient relations, people who suffer, because they ask questions. When they are bringing the actuary, they ask you, doctor,
How long?
How long?
Oh.
Will he, what is success rate? You know, when they ask you, as if you are the one to
No,
do they ask you, what is success rate? They want to hear me say 100.
Yeah.
And I say, hey.
So, but before we move into trauma, that's actually what I
Yes.
want to say, because it's a question that I think a number of persons may be having right now, which is this. Let's paint a scenario here. The head of a corporation has a substance abuse issue. This person has been responsible for the lives of hundreds or thousands of people. Now he has finally decided to get help. He's now in the process, psychotherapy, all of that. So the question now is, no offense to that head of corporations, with his reduced
Brain
the
size.
size, as he's recovering, can he return to that position and be trusted? Because you talked about it is the decision-making aspect of his brain that is affected. This psychotherapy, the treatment, can it take him back to a state where nobody needs to worry that this is someone who is recovering, so he might not be able, his decision-making
Not be accurate.
is gone, because it's smaller than the rest of our own who work under him. So that's what I want to know. When we're talking about recovery, that person's functioning, can it return to what got them to the head of the corporation in the first place? Or is it a case of, like you say, it's for life now? That's
Yes, thank you. Don't forget the treatment or recovery phase is for life.
okay.
As far as individual continue with line of the management, there won't be any issue. Because what the management will do that aspect that is distorted, that is affected, we are covering it back. The chemical being produced, which is dopamine depleted, we are given in terms of medications, and then things that can trigger, we are taking it out of the person's life.
So they can function like
They
before.
can function like before. But in terms of, you want to see the size of the brain, the way it looks, you see that it cannot regain that. That is why when you do imaging for younger individual, you now say, how come that this brain looks smaller like somebody of 70-year-old? There are background issue.
Okay.
So just as you have said, the chronicity, for drug addiction. Now, it's not only drug addiction that has that chronic pattern, right? For instance, hypertension. For instance, diabetes.
Diabetes,
Now, if
exactly.
you don't take your medications, if you don't observe dietary modification, lifestyle modification that you are counseled for, right, the person's blood pressure may begin to go up, right, which is hypertension. And when it gets to an emergency level, the person is asked to leave office, go and rest, or take some time out, right? Now, it doesn't mean that the person cannot return to the office when the person is able to manage the blood pressure to a level that is consistent with survival, right? So it's the same thing. So we must begin to see addiction as one of the chronic illnesses, because the first thing Chief said is a chronic brain disease.
Exactly.
Hypertension is a chronic heart disease.
Exactly.
Right? So drug addiction is a chronic brain disease. So the earlier we understand is the better. So that you don't keep seeing somebody who suffers addiction as if, he should have stopped since last year.
Oh.
So you shouldn't be surprised.
Despite Dr.
Yeah.
Hope's efforts, what's going on?
Now, in fact, the stages of change are 6, and the 6th stage is relapse. That means relapsing is part of the process of recovery. So that someone went in for rehabilitation, returned after a year, 6 months, 1 year, 2 years, he relapses.
So you expect that?
It's expected. It doesn't mean that
It's must.
treatment has failed. No, it's not treatment failure. Do you understand that? So people must understand that it's a chronic issue. So that is why the same way somebody will take his medication for hypertension now and then adhere to counsel about not taking alcohol, not smoking cigarettes, right? Or not exposing himself to long hours of work without resting. The same way, the person who takes or suffers addiction should take to the advice of don't go to these places that have been mentioned. Don't dial the number or have the number of this dealer
Person.
on your phone. Yeah.
Okay.
Exactly.
Yeah. I was going
And
to.
that should continue for life.
Indeed.
Because the person who is hypertensive, if you stop your drugs after 1 year,
The blood
the
pressure
blood pressure will go
increase.
back.
Okay. So I want to ask a question now. What some addiction experts say, they say, and I quote, trauma is often the addiction before the addiction. So from a neuroscience perspective, do you agree with this?
Yes. Now, there are different factors that put individual in the first place to start use of those substances, just as been highlighted before. And it can be a traumatic experience while growing up. Child abuse from the parents, from the relative, from school, colleagues or teachers. Repeated mental trauma or physical trauma that makes individual have to say, oh, to come out of it, I need stimulants. I need a enhancer. Being introduced to that by a friend or colleagues. Oh, that would be the beginning of the thing. Started using the substance. And now, that will now form another chronic brain disease with all the features we've highlighted. So, having trauma, which is not only physical, and the psychological trauma the person has been having while growing up. I met somebody not quite long was telling me that, oh, do you know I cannot even stand in front of people to talk because while growing up, whenever you want to talk, you shout at you, don't talk, don't say that, and started withdrawing to herself. So it is a problem that has been there before that one now still join it.
Sorry. Yeah, I don't know if you can debunk or confirm this for me. I heard that when you talked about relapse, that people who relapse are at more danger to succumb to the effects of drug because of the process of addiction, which is that you needed more of a substance to get more high. Then when you went through the process of recovery, you went back to the dosage that you took when you needed very high. And now it's too much for you now that you are a bit more recovered. Is there any truth to that?
Yes, there is an aspect of it that is true in the sense that don't forget we talk about the drug memory. What individual has been used to before, that memory is still there. So relapsing, going back, the tendency is there that he or she will start from that higher falling that has used to. And
can they take
relapse, yes, that relapse, if the therapy or the therapist not available or close to this individual, that is when it is more dangerous. Because taking that higher volume after several years or months out of it can lead to acute complications. And the acute complication that is more common is bleeding in the brain. Yeah, and when that happens, some of them, the bleeding may be fatal.
Can we actually talk about this? We've talked so much about the negative effects of addiction being in what happens and how you behave, your businesses, your relationships, and all of that. What about the actual medical aspects? The other day, like we spoke about before, we saw someone who was having decayed or rotten body and all of that. What is the end goal at the end of the day? Let's say you keep taking, because for instance, people become high-functioning individuals. They do well, they perform better when they take certain substances. So how do you explain to someone that if you continue like this, other than the fact that maybe you can't go to work like you used to, you don't speak the way you used to, what is the medical thing that is happening in your body that is going to possibly, if that is what will happen, lead to you dying or you becoming incapacitated?
Yeah, thank you very much. Don't forget, in addition, rewarding system, or what we call surviving system, is being depleted.
Okay.
That is ability to know that, oh, you need to eat, you need to relate with people, you need to run when there is danger, you need to this, has been affected. So individual that is being diagnosed of addiction lost this. Now, that is why you can see individual will just focus on that substance, neglect the meal, the food supposed to eat.
So they
and from there, exactly, we'll be losing weight, be emaciated, and from there, you will just die. Not only that, other things will creep in, other medical conditions, and for that person may not even see need to even bath when it's supposed to bath, may not see need to even change clothes. That is why at the chronicity end, you see somebody wearing clothes. Do you know that this clothes is dirty? Or still believe it's high. Oh, it's on top of wall, this and that. Do you know the clothes is wearing is dirty? There is need to change it. And from there, other medical conditions creep in. and somebody can even be on the road where they're supposed to dodge when there is danger. He will not. Just believe it's okay.
They're Superman.
Exactly. He may even be on the bike, maybe driving, and say, oh, that's pothole. They don't believe he can drive and jump and just kill himself. So, because the normal surviving mechanism for us to live is no more there. Okay, this is dangerous. You cannot eat this thing. Oh, somebody say, oh, when you take this thing, don't have unprotected sex. It doesn't matter. We dip.
There's this inhibition of the normal.
He will not believe that. You just dip his head and have the HIV and others. So all these medical conditions are already on ground for those that cannot make that decision again, that they are out of the normal surviving ways. In terms of eating, in terms of the wearing clothes, in terms of dressing, in terms of where to stay that is safe, in terms of what to do that is safe. They don't have that insight to that again.
What about things like what regular people say, heart attack? Some people say your brain knock. I don't know what the medical terminology for that is.
Now, in fact, the heart attack you mentioned, addiction, one of the medical complications is cardiovascular disease.
Oh.
They can have the blood vessels can get stiffer, and even those that use injectable, they get infected. They can have wounds, they will not even care. They just believe it's ordinary thing.
Vessels and can throw embolus.
So can have embolus, the clots forming in the artery that will disperse to the heart, disperse to the brain, and will just cease. So all these are medical things that can happen with addiction. And not only that, for those that have been used to taking such thing, once they have that medical condition that require them to even take step for treatment,
They won't.
decision-making mechanism is not there. They won't take that decision.
So just one more question: is there a medical term for what people may call madness? Because that's what people think, that if you take it long enough, you enter streets, you start to run, and that's the end of it for you.
Well,
And I want to know, can that? We've seen instances. Okay, where
Chief is
yeah, we've seen instances where someone's picture or video, they saw them on the street and they said, no, it was because of the things he's taken. Now he roams the street. He's a mad person. I don't even know if that phrase is medically correct.
We don't use that word, mad person.
Yeah, so
we say the person has the mental illness, which psychiatric problem. But generally, we say it has mental illness.
So I'm referring specifically because we talk about mental health issues here, and I think to an extent, our audience has become enlightened enough to not immediately think that is it. But I want to know if there is a medical way to refer to that, where someone who is dressed like me suddenly ended up on the streets.
We call it mental illness. That is the acceptable terms that will not be derogatory to anybody.
Okay.
Yeah, sometimes they can just say, he has a mental health challenge. You know, I've also said severally.
I should add that you keep calling him chief because he's the chief medical director.
No.
But it could be other things as well.
Well, in medicine, you call your seniors chief.
Exactly.
So you see, there was a question Amadin was asking, with respect to full recovery for individuals who suffer this addiction. Now, the truth is, they don't only have their life before or after treatment or after coming into recovery programs do not revolve around the addiction. There are people who, although they have an addiction, it's not every time they don't have a clearer mind, right? Because which is one of the challenges for families, especially when they have a very intelligent child who 10 hours in a day, he's okay. You won't believe that he has a problem. He will function normally. But at night, after he has taken his substance, he becomes something else completely. Now, so that person may be able to handle finance. If finance is not his trigger, that person may be able to, sort some problems for the family. They say, if this guy handles documents, he can write proposals. If he presents to you, you understand? So now, which is why we say addiction doesn't define the person. You must know that there are different components in the person that makes his personality. And addiction is just a challenge, which, of course, everyone has their own challenges. Now, but for this particular one, it's affecting areas in the life of the person that is becoming dysfunctional and is causing worry for significant others, right? Now, that being said, Chief, how will you respond to this? You have mentioned the prefrontal cortex, and we know that this is about the part of the brain that develops the last, up to mid-20s. Now, especially with adolescents who begin, indulging in substance use, and the reward system seems to develop before this time, faster. So, and this reward system is that part that controls pleasure. You want to be happy, you want it now, you get it now, nothing, no delayed gratification, which seem to characterize our world currently. Everybody wants to make it fast.
Exactly.
If I see Dr. Samson now, I want to wear the suit he's wearing, forgetting that he has, Dr. Samson has just been recently elevated to the position of the CMD of Everest Laboratory Diagnostics. Am I correct, sir?
Yes, thank you.
Now, somebody who is a young doctor will just want to become the CMD of that kind of organization
No.
without thinking through the sacrifices, the process. Now, again, for us psychologists, we don't, we understand what happens, because for younger people, that's a part of the brain that develops faster than the prefrontal cortex that builds personality, judgment, long-term, and all of that. So, Chief, neuroimaging-wise, what can you explain to us?
Actually, when we have cases of addiction, and we're evaluating with, as I've said, the images are readily available, CT and MRI. But most time we use MRI to evaluate, unless if it has evidence of hemorrhagic component, bleeding, that, we can quickly do CT and identify this. Most time we only report what we can see that, there is evidence of atrophy, this and that, as the brain gets smaller in this part. And for those that have been exposed to chronicity, they may have microvascular changes, which we call white matter ischemia. So we may notice it on imaging and we'll report it. And it's just to guide the neurologist or the psychologist or psychiatrist in terms of the treatment at all. We didn't see any other thing that may be causing this. The signs and symptoms of this patient, but this is what we can see, which we guide them in terms of the treatment they will give. Now, generally, I think that is what imaging will see. But in our environment, that is why repeated or continuous education, medical education is very important, just like what we are doing, to enlighten people what the danger ahead by taking certain steps. Especially the younger ones, they believe, when you wake up, you can become this, you can become that, without the due processes that are involved. So by this type of program that we are doing to educate general population will go a long way to help the society at large. In fact, there are different programs that can arrange for younger ones in secondary schools or in universities that they can learn from, that, don't take this path, irrespective of what may put them into it. We must emphasize that it's not worth it to take that path.
But sir, what can you tell them about what's different about? Because all along we've been talking, we're assuming a fully formed brain of an adult. Like Dr. Hope said, this talking about an adolescent who has a developing brain. How is the effect more terrible for them if it is? How does it affect their development in the first place?
So, in fact, Chief, for the adolescent, the reward system part of the brain is almost fully developed.
Yes.
So that means you see them, they are exhibiting the same desire, the same passion of life as an adult. Right? But unfortunately for them, their prefrontal cortex area is not fully developed. It's still forming.
So the part of them that is supposed to help them make good decisions
It's
was
still
not
forming.
ready in the first place.
Exactly. When they are beginning to crave for everything life has to offer.
So that if they're exposed to those substances, it will bring that aspect down faster.
So unlike an adult who may have already been making good decisions, for an adolescent, you don't even get the opportunity to make good decisions.
And that is very important for the parents and the caregivers to take note of that.
Exactly.
Peradventure, they find any of their wards doing this, they need to take care of them with care, utmost care.
That's it.
Not to think, we're supposed to, no.
to flog them.
Because it's like a double insult.
Yes.
That aspect that can make good decision is still informing
It's still
process.
informing.
And now this insult
attacked.
on it. So the impact is usually huge on adolescent than the adults. So when we see any younger one in that, then we need to tailor the treatment. We need to follow up the proper treatment, not to leave him or her that, oh, it's supposed to be okay, it's supposed to be. No, we need to follow it.
So look at the issue at hand, sir, Chief, the contradiction in the child's mind. For instance, you have a car, and your maybe 15-year-old boy wants to drive that car. But Chief, you who is driving the car, when you enter the car, you want to check, is everything intact before you drive? Why? The prefrontal cortex is developed.
Yeah.
Exactly.
You are looking at safety before you drive.
Exactly.
When I drove my father's car the first time, I was under 18. I was meant to just clean the car. But it was inside. I drove out, I bashed on the fence, I continued. Now look at that, because my own area of reward is I just want to drive, it's fully developed, but I'm not thinking of the consequences, which is what the prefrontal cortex does for the person. It's not thinking of the consequences at this point. So you see, this child went on, unfortunately, indulging substance because his desire is that of a human being. I mean, an adult. But the prefrontal cortex that should have put him in check or mitigate the use of substance is not fully developed. You now, the adults, you are looking at this child as if he is an adult whose prefrontal cortex is fully developed. Why will you do this? You shouldn't have done this. Now, him is acting as if his prefrontal cortex, his desire is at full adult. You are looking at him as if prefrontal cortex is full adult. So there's a contradiction. The child is acting in his capacity, desiring like a full adult. You are correcting him as if to say, adult. You should know this as an adult, prefrontal cortex.
Yeah, it is.
So it is very important, like I said, the parent out there or getting out there to know this, that we need to guide these younger ones. They don't know what they are doing, summary. So we need to guide them and put them right.
All right, so let's quickly move to broader conversations of policy healthcare. We've spent the better part of our time here talking about or breaking it down about how addiction is a disorder, not a moral issue. Having that knowledge, what should change in how we approach care and rehabilitation in the country?
Oh, thank you very much. And I will start by saying care of any individual with drug addiction is multidisciplinary. It involves different aspects of medical care. It involves normal medical care, that is a medical doctor, a general physician. It requires a psychiatrist. It requires a psychologist. It requires pharmacist, and it requires nursing, and also it requires a radiologist in interpretation of neuroimaging. And because all these cadre of healthcare workers are important in bringing individual to normalcy, the role of psychiatrist or the role of a psychologist cannot be substituted with another department or another aspect of medicine. Now, and since it's multidisciplinary, and any individual that has addiction problem is of public health importance in the sense that the individual cannot only affect him or herself, but can affect anybody in vicinity. Therefore, it needs to be approached in that manner. Now, we advise our government to do more in terms of affordability of rehabilitation centers, where all these professionals I've mentioned need to be engaged to take care of individual. And any individual you neglected not to take care of can cause a suicidal effect on the community, not to himself. For instance, you have been given instances where individual, you are driving normally or you are by the roadside, an individual that has been suffering from addiction will be driving and kill individual waiting on the side, cause injury to another person that is even driving in his own car normally. So that is why it needs to be approached in a holistic manner.
That's a public health concern.
Exactly. Not that, we look at it doesn't matter, this and that. And it is very important also to make policy to restrict or to control access to all these substances. Some of these substances are being imported, while some are being grown in our country. So we need to do more as we have the drug enforcement agency, we need to empower them more to give them enabling environment to carry out what they need to do. I remember when I traveled to one of the countries recently this year, I was told that if you are going to certain countries, you need to do drug tests. So I was asked to stay in a particular corner. I said, the medical doctor said, you have to do it. And I have to urinate and do drug test for me. And the result came out normal. And I was asked to stay, and they captured me immediately. And I did fingerprint and said, I didn't know this is positive. This is how I will be captured, just like you want to put somebody in the prison. I said, this is very important. Now, I think the government is thinking they can introduce it to secondary school or as a part of things to use for admission purposes. And this will go a long way if you can do that. So that a child maybe has been exposed to such, will know that, it may affect direct future of his education or career. That you want to have admission, you have to do this test and must be negative. So that can also serve to prevent them from endangering in that. And also, our parents, they need to support the younger ones, considering that when they are taking some decisions, it is not their win totally, because the part of the brain that can make good decisions is not yet formed. So, and if they're now exposed to different vices where they are growing up in the schools or where they are living, they may just follow and started using those illicit drug, and compounding the problem that the part of the brain in decision making is not properly formed will be depleted. So we need to talk more to our younger ones, and then to let them see the reason why they need to survive, the reason why they need to live for better tomorrow. We need to engage more at the parental level and also at the community level. And when we see anybody in the society, that has started eliciting action, let's report appropriately to an agency that can take care of individual. It's not to arrest and lock the person up, no, but for rehabilitation purpose. Something happened to a family friend yesterday that the mother just has an incident like a mild stroke, bare palsy, and it happens outside the country. And within 30 minutes, ambulance arrived and they took care of the woman and went back at the end of the day. They said, wow, this thing happened. I said, yes. In such country, they are very good for emergency. But in terms of chronic cases, they may give you an appointment 4 months, 6 months, until the person even deteriorated. So what am I saying is that there should be more involvement of government as a whole in care of any individual that has been diagnosed with drug addiction, which can help. And rehabilitation, as we already said in this, is a longer process, is a lifetime process. So for general population, just an example we gave, if somebody is diagnosed with having hypertension today or diabetic today, it's different from somebody having malaria. You take drug within 3 days and you're okay. You have been diagnosed with hypertension today, you are going to take your medication for life. You've been diagnosed with diabetes, you're going to take that medication for life. The difference there is that when you are regular on the medication, you will reduce the dosage, but not that you will be out of the medication. So rehabilitation of individual with drug addiction is for life. And for our fear at home, if you have anybody, you are taking your ward or your relative for care. Don't say, when is it going to be out? Is this 6 months? Give me 1 month. 1 year. No, it's more than that. If you want to have good result at the end of the day, it's a lifetime treatment. Thank you.
Thank you so much for that. I think that was extensive enough to understand what to do with policy and all that. So maybe if Dr. Obi is not adding anymore, we can still clear some sort of misconceptions for me. I've spoken with some persons on the recovery part who say that they got better on their own. And some experts have said that certain changes in life, maybe sometimes having more responsibilities, a child has come into play, you were living life before, and the changes happen. Do these things happen naturally? What's happening in that regard? No. When people say they didn't have to go, some persons have even said that they went for boot camps with arts and music and that was what led them to depart. It wasn't medicine. It wasn't.
Now, in terms of treatment, let me use the terms of management. There are different stages of management. It is not all the stages that require giving medication. It's not the cases that require, being locked up in the house or in the center, being quarantined. No. Now, the individual that are saying, they get out of it naturally. This is because they were exposed to a form of therapy, psychotherapy, that bring them out of it. It can be in form of, move away from the cues, things that can trigger it, move away from it. It is because, this individual is less busy. That is why he's exposed to this. Now, let the person be occupied. So it's a form of treatment. It may not be a written or being, the individual is being tied down in a rehab or is being quarantined. No, the treatment can come from the family member. This child is doing this one. Let's even change the environment. Let's take it out. Let's be talking to him. Even maybe in a form of religious setting. Let me be doing prayer early in the morning or this and that. That will take the person out of it. But as a form of management.
In real life experience, I've had parents say things like this. This person's son used to use this substance. In fact, it was even worse than him. And he stopped on his own. Now, the truth is, research has it that only about 10 to 15% of people who use a substance would need an intervention to stop. That means we require, intensive psychotherapy or having to be confined in a facility for admission, right? Now, you would never know what percentage the person will fall into. So if the person is in the percentage of 10% who will need intervention, you will see him going through the whole hog of up and downs in treatment. He's relapsed today, or he's come back to treatment today, like that. Now, but if the person falls into the larger percentage of 85 to 90% of individuals who will not have such challenge, they can wake up one day and say, I'm not using again. And that's the end. We've had such stories. Now, this is based on individual biological or genetic makeup. Right? For myself, as a person who had used at the age of 11 years, all right, at 13, I was caught by my parent. And with talk here and there, talk therapy. Even if the talks were some of them were abusing. But it was therapy.
And just work.
So it worked. So I didn't have to, right, be in any rehab center to get help. Okay, so it worked. And that is still therapy. All right. So now the person who is saying, I stopped on my own, if you check, he probably will not go to this place where he used to take substance again. That's therapy. And the person will not call or keep friends who use this substance again. That's talk therapy. That's therapy in itself. Now, talking about art therapy, they've also been, evolving and growing, data around some non-conventional therapeutic measures. It's still therapy, right? Okay. And it's simply substituting your cravings. There are people who, a sickle cell patient, for instance, who suffer, severe painful crisis intermittently and is hooked on substance. One of the treatments would be replace it. When you feel that pain, can you write your pain down? Some go into writing, some go into drawing, their emotion, just expressing their emotions on art, right? So all of those are therapy. And one of the good things is that when you are doing that, it may take your mind away from the craving. And so every craving, as we say, has a lifespan, all right? So if I feel like eating rice now, and I'm craving for rice, if I don't get it for maybe 5 to 10 minutes, the next time I feel like eating it, I may not necessarily go out of my way to get it. Right? Because, so if I feel like eating rice and I know it's not available, I'll just say, what is available? Give me sandwich. You see, I have replaced that craving for rice with sandwich. And so if I keep getting sandwich, after a week or two, I may not crave rice again. I may start craving sandwich. So you see, they can substitute the cravings. So if someone substitutes that craving for a particular substance of abuse for art, it can be that's therapy. So it doesn't mean that because I'm now, is not.
Can you substitute one addiction for another?
Of course, yes. Of course, yes.
So is that recovery?
Now, I'll give you a life experience. A mother brought the daughter. The daughter had used a particular substance that they may think is a high substance. We don't like to say hard substance or soft substance. If you say hard drugs, it means that you are excusing in the mind of the sufferer that he can use other ones that they may think is soft.
Yeah.
So all drug is drug.
Okay.
Drug is drug. So leave it like that.
Okay.
Now, so she was in a particular substance. If I checked herself into a rehab center because of that particular substance and called the mom and said, I'm in this place, please come and pay the bills. The mom went and paid the bills and was happy that his daughter took that decision. Now, she started using a cheaper one.
Yeah.
Now, the mother, so she was admitted in my facility. Why? Because of that cheaper one. And the mother was wondering, why was she able to stop this one, seemingly hard one, and can't stop this? Now, this is it. This one you are talking about is cheaper. She can easily afford it. She was wise enough to realize, you know what, this is taking a lot of money from me. So can I substitute the addiction? So she just simply substituted the addiction with another drug that was convenient for her. So you see, but is it causing the same effect in other areas of her life? Yes. She became an hedonic. Like Chief said, you become unmotivated to do other things. Motivational syndrome. You know, she would just want to stay in her room upstairs, just be relaxing and listening to music, burn aromatic stuff, and just chill and just take her stuff. So you understand. So that's the thing.
I think we've cleared up. Do you want to say something, Doctor?
I don't know. I just want to tell our viewers that it is not a crime for somebody to be diagnosed of drug addiction, but it is a crime if you fail to come for treatment. Now, life is better if we realize that, oh, this is wrong. Let's take these steps. So, if you see anybody with drug addiction, that is not the end of their life. There are treatment for such individual. Thank you.
Okay. I want to have a program, but I just remember something.
That's a question to you.
Okay. Well, I remember something you said, and I don't know if you can quickly clarify that for me. You said something about different weight sizes, different, gender aspect, predisposition. Were you hinting that if you're on the chubbier side, you're less likely to?
Okay, well, I want to know if I'm Chief a question. I'm not the guest.
Yeah.
Now, Chief, considering the neuroscience of addiction, you have educated us on the fact that there are actually changes in the person's brain that makes it difficult for the person to make right decisions, have good judgment about his behavior. You even said that when they suffer other medical illnesses as a result of the addiction, they also are in a place where they can't take good decisions for those illnesses. Now, would you advise, therefore, or what's your take? Would you advise that people who suffer addiction, who have poor judgment, for instance, and of course also low cognition sometimes, would you advise that they be taken into treatment without their consent, since they are not in a position where they can fully take decisions for their health? Answer this in the light of an unconscious patient who cannot also take decision for his health.
Yes, thank you very much. And there may be different line of thought towards that patient must have autonomous, which simply means you have right to decide the type of treatment you want to take. That's what it means. It is part of ethical practice all over the world. But in this case, individual that cannot make proper decision, good decision by himself, there is need for help. Her need for help is to how we make this person to have insight to the problem is by going for treatment. So I will give this, on my own opinion, that such individual can be helped to a rehab treatment. In such case, you just have, like if you want to do some examination, say look for a chaperone. In such case, you have the relative that will be in line. Maybe the next of kin, that person, exactly, that will give consent for the person treatment. But knowing fully that individual is not knowledgeable on what to do because of the addiction. So such individual needs help. We only take the consent of the relative or next of kin to do that. Don't forget, injury to one is injury to all. Individual in the community that is neglected for anything will become a general problem. Just like what we said, we decided to say, oh, this fire, you can put fire in this building, doesn't mean anything. I'm born.
So, in fact, just like you said, a patient just got up one evening and said, you know what? my mom have some collections of pants that were bought for her by a pastor. He was telling me when I eventually picked him up, he said, how will a pastor be buying pants for my mom? And this never happened. Yeah. And so that evening, she brought out her mom's clothes and burnt them in defense of her dad's integrity, of his dad's integrity. So why would a pastor buy that for my mom? So that tells you that this person in this state of disorganized judgment
cannot make decision.
Cannot even make decision. So if we are saying, oh, he has a right to decide whether or not for treatment
to cause
harm.
more
This person is burning the house. Do we wait for him? This person is making sure that he's even harming himself. This person can get on the wheel and drive the vehicle and run into an innocent person.
Exactly. So that is why we need to take decisions to help individuals.
Exactly. And then literally speaking, I've heard patients say things, oh, I'm going to sue my parents. I'm going to say, I have rights in the Constitution of Nigeria, right to freedom and the rest. Again, there's a caveat in that Constitution that is for the rational mind. You don't have a rational mind. Nigeria cannot let you loose on the street because you have right to freedom. Because where your right ends, and that person's right will stay. So, people who have you should understand that when parents take you for treatment, it's not because they are taking your right away from you or they want to do so. It is an assistance. They are giving you the support that you require. And maybe this is seen from the perspective that rehab care programs are punishment for wrongdoing. But as we have said, it's not a moral failing. Yeah. And so rehab care program being afforded by families are not punishment for wrongdoing. It is actually the support and love and help for you.
You need it in more ways than one. You need it for your brain as well. Thank you so much for being Doctor, for breaking this down for us.
Thank you.
All right, that's how we round off this enlightening episode of Beyond Addiction podcast. Do join us again next time for more aspects of how we tackle this issue through, before, and beyond addiction. See you next time. Don't forget to like, share, subscribe. Bye for now.